Surgical management of hydrocephalus. Hydrocephalus is managed surgically to divert excess cerebrospinal fluid (CSF) and relieve intracranial pressure. The specific surgical approach depends on the underlying cause, type, communicating or non-communicating, and patient characteristics. Here are the primary surgical techniques. 1. Ventriculoperitoneal VP shunt placement. Overview. This is the most common surgical treatment for hydrocephalus. A catheter is used to divert CSF from the brain's ventricles to the peritoneal cavity, where it is absorbed. Procedure. A small incision is made in the scalp. A catheter is inserted into a lateral ventricle. The distal end of the catheter is tunneled under the skin to the abdomen. A valve regulates the flow of CSF. Advantages effective for long-term management. Adjustable valve shunts allow for CSF flow control postoperatively. Risks. Risks. Infection, shunt malfunction or blockage, overdrainage leading to subdural hematomas. 2. Endoscopic third ventriculostomy, ETV. Overview. ETV is an alternative to shunting used primarily in non-communicating hydrocephalus. It creates a bypass to allow CSF flow between the ventricles and subarachnoid space. Procedure. Performed using an endoscope inserted into the lateral ventricle. A small hole is made in the floor of the third ventricle to allow CSF drainage. Advantages. Avoids long-term complications of shunts. Effective in certain types of hydrocephalus, e.g., aqueductal stenosis. Risks. Hemorrhage. Inadequate CSF flow, requiring additional surgery. 3. Ventriculoatrial shunt. Overview. CSF is diverted to the right atrium of the heart via the internal jugular vein. Indications. Used when abdominal placement is not feasible, e.g., peritoneal adhesions. Risks. Cardiac complications, thrombosis, or infection. Nash 4. Lumboperitoneal shunt. Overview. Diverts CSF from the lumbar subarachnoid space to the peritoneal cavity. Indications. Communicating hydrocephalus or idiopathic intracranial hypertension. Risks. Nerve root injury. Overdrainage complications. 5. Aqueductal stenting. Used in aqueductal stenosis, stents are placed in the cerebral aqueduct to maintain CSF flow. Indications. Alternative to ETV in specific cases. Postoperative care. Neurological status, signs of infection, and proper shunt function. Imaging. CT or MRI to ensure adequate CSF drainage and assess for complications. Long-term care. Regular follow-up to monitor for shunt-related complications or the need for revision. Emerging techniques. Programmable shunts allow non-invasive adjustments to CSF drainage rates. Endoscopic techniques. Continued advancements reduce the need for open surgery and long-term shunt dependency. Each surgical option has specific indications and risks, so the choice depends on patient factors and the underlying cause of hydrocephalus. A multidisciplinary approach ensures optimal outcomes.